So now we're trying to build our foundation on, talking about several hormones and how they are able to, affect the body. So we're trying to look at the pharmacology, because some drugs could be made to mimic these hormones. Okay, so to say, they work like the hormones. So do you understand? So thereby, so we're looking at the hypothalamic. We're looking at the pituitary hormones, we're looking at the thyroid hormones, what are their pharmacology. So I think we'll be treating them one by one. So this is the overview. So you should know that what is from one thing to another, from the hypothalamus to the pituitary, then of course down to the thyroid. So it's actually an endocrine axis, that's what you call it, okay? Because together they work to achieve the same thing. So of course, the hypothalamic release hormones that regulate the thyroid formation. Do you understand? It's a much more clearer image. So we're actually talking about this one, okay? Of course, the pituitary should control many other things, but we're actually talking about the thyroid one. So the pharmacology of hypothalamic, pituitary, and thyroid hormones, we'll be picking them one by one. So hypothalamic hormone now, we have the gonadotropin-releasing hormone. It stimulates luteinizing hormone and follicle-releasing hormone. Okay, so it forms the basis to why some drugs are being produced. So we have some drugs that will actually make this gonadotropin-releasing hormone work more. We call them the agonists, like the leuprolide. We have the goserelin. We have the ones that will actually hinder its actions, like the cetrorelix. We have the degarelix. Then growth hormone releasing hormone stimulates growth hormone release. So have drugs like those somatostatin. Okay, should inhibit growth hormone, thyroid stimulating hormone, insulin, and glucagon. So have all these drugs will have their applications. When we come back, we're looking at the individual drugs. You guys will actually have a better knowledge of it. They also have the pituitary hormones. Okay, like the growth hormone stimulate the insulin growth factor. Okay, so have drugs that will actually prevent it. Let me say somebody's growing too much, so you want to now give some drugs that should prevent it. So have drugs like the pegvisomant, also the prolactin. They will have the gonadotropins. They are used mainly for infertility treatment to stimulate ovulation or spermatogenesis. The thyroid hormones now, we have all those thyroxine, triiodothyronine. They are mainly used in cases where your thyroid hormone production is low, so you want to replace it. Do you understand? So drugs like the levothyroxine, we have the leothyronine. So we have the anti-thyroid drugs too. These ones are against the action of the thyroid hormone. So we have drugs like the thioamides, okay, all those metimazole, propylthiouracil. We have the iodides like the Lugol solution, the potassium iodide. We have the radioactive iodine. We have the beta blockers like the propranolol. So the general pharmacokinetics is anything hypothalamic or pituitary drugs, they're usually short life and usually give it through the veins. You understand? They can't really withstand all the stomach processing. Therefore, the thyroid hormone, they're usually given through the mouth because they have a long life and they can withstand the stomach processing. So in general, hypothalamic agents are mainly for those fertility issues, treat all those hormone related issues, while pituitary is also all those growth related issues, also fertility issues, and also adrenal insufficiency. While for the thyroid hormones, thyroid agents, that's drugs that are developed towards thyroid gland. They will mainly be used when thyroid hormone is little, so you want to replace, or thyroid hormone is too much, so you want to reduce. You understand? So this is it. Don't worry. We'll come back and we're talking about each of the drugs. You guys will get to understand the adverse effects more.